Today on Up Front, the Senate health care bill revised. Will the changes win the vote of Wisconsin Senator Ron Johnson? And does he think the bill will pass in the end? I'll ask him next on Up Front. Then a new face in the race for governor. Democratic businessman Andy Gronik on what he brings to the campaign.
Covering the issues important to Wisconsin. This is Up Front with Mike Goucher.
Hello again, everyone, and welcome to Up Front. The U.S. Senate may vote later this week on a revised health care reform bill. And once again, Wisconsin Senator Ron Johnson will play a key role in deciding its fate. The latest version of the Republican bill to repeal and replace the Affordable Care Act would actually keep a couple of Obamacare's taxes on the wealthiest Americans. There's more money for state-based health care initiatives to help drive down premiums. There are additional dollars to help states fight opioid abuse. And there's greater flexibility for states to decide how to spend Medicaid money on the poor and disabled. Will Senator Johnson support it? He joins us now from our Green Bay affiliate, WBAY-TV. Senator, it's good to have you back on the program. And you have said that you're prepared to vote for a motion that would allow this legislation to proceed, but are you prepared to vote for the legislation itself?
Good morning, Mike. Well, let's first set the table in terms of the failed architecture of Obamacare. The individual markets are collapsing because we've asked a very small slice of the American population to bear the full cost burden of covering people with high cost and pre-existing conditions. We've got to change that. Unfortunately, I don't think the Senate bill goes far enough to do that. Legacy Medicaid, that's what we have here in Wisconsin. We manage it very efficiently. We're the only state that closed the coverage gap caused by Obamacare. That's put at risk because of Medicaid expansion. I don't think we're going far enough in terms of throttling back on Medicaid expansion, which again puts at risk the legacy Medicaid that covers elderly, children, disabled. And by the way, Medicaid expansion is targeted toward able-bodied, working age, childless adults, and the federal government pays more for their Medicaid than it does for a disabled child. So that's what I'm trying to rein that in, not pull the rug out from under anyone. But I'll tell you one thing that's going to change my calculus potentially are some comments by Leader McConnell apparently made to some moderate senators that are asking for more spending, throw more money at a problem. Said, don't worry about the change in Medicaid CPI. That goes so far in the future it'll never be implemented. That's a real concern to me in terms of our ability to trust whatever's being promised in the bill that we're being presented.
So as of today, are you more likely to say yes to this, or does that change in the potential calculus you just referenced, does that make you still very much on the fence about this?
Well, yesterday I was talking about absolutely going to be supporting the motion to proceed on this bill. I'd been given more time. I had a chance to talk to constituents. I think provide them a little comfort from a standpoint that I'm going to do everything I can to fight for legacy Medicaid, protecting elderly and disabled and children. But I have to admit the comments by the leader, I've got to confirm them. I got to find out exactly what he said, who he said it to, what he meant. But that has certainly put a question in my mind as whether or not I'm going to strongly support a motion to proceed on this bill.
So if you don't get the answer that you want to hear from the Senate Majority Leader, you could vote against this. That is that important to you?
Well, I'm afraid that might turn a number of people off. So I'm not sure. I think those are if they're true, very ill-advised comments and really puts the whole process at risk.
Senator, what's better about this piece of legislation in your mind than the previous version? What has been added to it that you think is a good thing?
Well, first of all, we allow individuals on the individual market, people that right now have seen their premiums double and triple, that have to pay those double and triple premiums with after-tax dollars. We allow at least a portion of those, and I'm trying to figure out exactly who'd be included in that. We allow a portion of those individuals to purchase their health care premiums with HSA dollars, which means pre-tax dollars, like the vast majority of Americans who get their health care through their employer. That equalizes the tax treatment. That's one of the things that have been grotesquely unfair about our health care system. One thing Obamacare didn't address. And so, that's certainly a positive aspect of it. I do believe that Medicaid expansion, again, Wisconsin did not partake in Medicaid expansion, puts at risk legacy Medicaid for again, children, elderly, and disabled. I wanted to end enrollment to that immediately, quite honestly. That would not be pulling the rug out from under anyone. We'd allow people that took 3 years, signed up for Medicaid expansion, to stay on it as long as they didn't have a job. And through attrition, you'd basically end Medicaid expansion. The Senate bill is going far beyond that and leaving Medicaid expansion open for 3 years. We're not only pulling the rug out from under anybody, we're leaving the rug out there for millions more to stand on it. So I had a problem with that. But again, the reforms, eventually phasing out Medicaid expansion, I think, is a good thing to protect Medicaid, legacy Medicaid here in Wisconsin.
Senator, how do you feel about the Ted Cruz amendment that essentially would allow insurers to offer these stripped-down coverage plans? They might be more attractive to young, healthy customers. There are people who say that's a good thing, and there are people who say it's a bad thing, that it could end up with a whole separate market of older and sicker people who would see their costs for health care go through the roof. What's your take on the Cruz amendment?
Well, I've always been supportive of legalizing affordable health care plans for Americans and giving Americans the freedom to purchase the type of health care insurance that suits their needs. So I'm definitely in favor of it. The problem with the Cruz amendment right now is trying to make compromise, trying to get more people to support it. It's taken it and made it probably less workable, less effective. What I'm for is isolating those individuals with high cost and pre-existing condition, and rather than making the very small segment of the American population, 5 to 7% of the American public on the individual market that are already paying for insurance with after-tax dollars, then in addition to that, pick up the full burden of covering people with pre-existing and high-cost conditions. Let's let every American pay for that. We've decided we want to cover people with pre-existing conditions, fine. You can do it in a way that doesn't collapse insurance markets. It doesn't result in premiums that have doubled and tripled. And Mike, think about that. 3 years ago, 4 years ago, premiums were a half to a third of the level they are now. The damage done by the faulty architecture of Obamacare is hard to overstate. The problem is, I don't think there are enough elected officials, including Republicans, that are willing to talk honestly about that, address the root cause of that problem, bring those artificially increased premiums down to reasonable levels, equalize the tax treatment, and really fix this problem.
Let me push back briefly, though, on your characterization of the Obamacare market. Politico story last week with the headline that said, despite doomsday rhetoric, Obamacare markets are stabilizing. And they quoted a Kaiser Family Foundation individual saying, we're not seeing any evidence of a death spiral or a market collapse. Rather, what it looks like is insurers are on track to have their best year since the Affordable Care Act began. I'm quoting now.
I think that's bunk. Again, on average, according to HHS, premiums have doubled, 105% increase. I know of instances where premiums have doubled and tripled, including elderly, which wasn't also supposed to happen. Premiums for young, healthy people were supposed to increase. For elderly, it's supposed to decrease. So, no, the architecture of Obamacare is completely failed. It will never work. Insurers are pulling out. They're providing notices that they're not going to continue to insure. We have seen a dramatic shrinking of the number of insurers competing in certain counties around the country. It's a completely failed and collapsing model. I have no idea what Politico's talking about. It's total bunk.
All right, I'm going to take a quick break. Senator, hang with us there. We will come back in just a moment. More of my interview with Senator Ron Johnson, including reaction to the latest developments in the investigation of President Trump, Russia, and now Donald Trump Jr. We'll be back in just a moment.
Up Front with Mike Goucher, brought to you by the American Transmission Company and the Wisconsin Corn Growers Association.